Providing physical care to our residents is an important part of what we do each day. This is a very special time spent with the residents. It allows us to really get to know our residents. It also allows us an opportunity to monitor and assess the general and overall well-being of our residents. Additionally, when we provide personal care, it's a tremendous opportunity to enhance the residents' feelings about themselves, their self-esteem. Helping them to look good and feel good is critical to outstanding care. During this video, we are going to talk about the fundamental steps associated with the provision of personal care. You will learn how to do such activities as help a resident bathe, help them with oral care, toileting, shaving, grooming, and so on. It is very important that we always focus on keeping the resident as independent as possible. How do we do this? Well, number one, we want to make sure the environment is user-friendly. We want to make sure they have all of their supplies within easy reach and easy grasp. We want to make sure that there's adequate lighting and that there is appropriate provision of privacy as the resident performs self-care. We want to encourage the resident, praise the resident when they are able to do something independently. We may stand by, ready to assist when necessary, all the while encouraging the resident to do the task themselves. We want to always do this in a dignified way, never in a childlike manner. When we talk about a resident performing an activity of daily living independently, we also want to realize that they are using muscles and using their cognitive ability to carry out self-care. The more they use that, the more they will maintain that ability. There's a phrase you'll often hear, use it or lose it. And it's really true. If, for example, every day you come in and fully dress a resident that is capable of doing so on their own, soon they may lose that ability. They may not remember how to dress in an appropriate manner. They may become stiff and less agile, lose the ability to bend down and tie the shoes. So it's important that we always encourage independence in a safe and dignified way. When we talk about the provision of personal care, we also want to consider the dignity and well-being of the resident. If a resident does require assistance, we want to do it in a very matter-of-fact way. Don't make a big deal out of it. Sometimes engaging the resident in pleasant conversation can distract them away from any embarrassment they may have about asking for help with an activity of daily living. When providing for the physical care of our residents, we always want to keep privacy in mind. We want to make sure that a door is closed so others cannot view the personal care that's taking place. If the resident has a roommate, we may want to escort the resident into the bath area for personal care, or perhaps ask the roommate to leave the room for a few minutes while personal care takes place. We also want to be cautious in public parts of the facility that we never discuss openly the provision of personal care in front of other residents or family members. One term often associated with the provision of personal care is activity of daily living, otherwise called ADL. You'll sometimes hear staff talk about, well, what help does Mr. Smith need with his ADLs? What they are referring to here are the activities associated with everyday life. The ability to get dressed in the morning, the ability to groom themselves, feed, and so on. So an activity of daily living is a fundamental activity associated with life. When we talk about activities of daily living, there are often three levels of care associated with assisting a resident with activities of daily living. The first one being independent. If a resident is independent with a particular activity of daily living, they need no help from us whatsoever. They are able to initiate the provision of that care and carry it out themselves. Another level is something known as standby assist. Now with standby assist, this may simply mean that we have to knock on the resident's door, go in and remind them to perform a particular activity of daily living. We may need to set a few things out for them, perhaps get the toothpaste out, set out the toothbrush for them. But they are able to perform the majority of that self-care. Another term associated with activities of daily living is full assist. This is where the resident really is unable to perform self-care. We need to not only set the items up for the resident and remind them that it's time to perform that activity of daily living, but additionally we must actually perform the care for the resident. Now sometimes even under full assist, a resident is able to do a little bit of the activity on their own. And as we'll talk about momentarily, it's important to encourage that independence. Some of our residents will need assistance with ambulation. Some of the things we'll want to understand about a new resident coming into our community is how much help will they need? Are they able to go about the entire community without any assistance? Or will they need some help using a mobility device? For example, a straight cane, quad cane, walker, or wheelchair. Some residents are able to ambulate safely, but when they first move in are slightly disoriented until they figure out where everything is located within the community. So we may need to escort them to the dining room. They are safe to walk independently, but they need someone just walking alongside of them to remind them where to go. Important points to remember about transfer and ambulation. First, clarify the amount of assistance the resident will require. Secondly, ask for help when necessary. For example, some residents will require the assistance from 2 caregivers to safely transfer or ambulate. Let's watch as our caregiver assists a resident to transfer. If the resident is using a wheelchair, place the wheelchair at a 45-degree angle to the chair the resident will transfer to. Always lock the wheels and remove the footrests. Make sure the resident's feet are planted firmly on the ground. Always bend at the knees when assisting the resident. Explain to the resident that she may put her arms on your shoulder if she is capable of doing so. Grasp the resident at the torso and on the count of 3, gently raise the resident to a standing position. Some residents will pivot and turn in one move. Other residents will prefer to take a couple of steps before pivoting. As you lower the resident, again bending at the knees, always maintain a firm grasp of their torso. Make sure the resident is safe and comfortable in their chair before leaving them alone. Let's review some tips on transferring. Number 1, if the resident is using a wheelchair, always remember to lock the wheels and move the footrests away. Number 2, make sure the resident has a firm stance before beginning to stand. Number 3, if the resident is seated in a deep chair, you may ask the resident to scoot forward slightly before beginning the lifting process if they are able to do so. Number 4, always have a firm, safe grasp of the resident. And finally, number 5, always remember to bend at the knees. Let's look at some things we should never do when transferring a resident. Never pull a resident by their hand or arms. Never lift a resident alone when 2 people are needed. Never leave the resident alone until they are safely seated in their chair or bed. For example, transferring a resident to the side of the bed and then simply walking away can be very dangerous. Some residents can easily slide off of the edge of the bed, so we'll want to make sure they're comfortably and safely positioned. Some residents will simply require an escort. They have a strong, steady gait and are able to bear weight. In this case, the resident can simply walk next to the caregiver on their way to the dining room or whatever destination lies ahead in the facility. However, if a resident is unsteady on their feet or has significant weakness on one side, this is not the correct way to ambulate the resident. If weakness is present, then the caregiver always stands on the resident's affected side and supports the resident by holding one arm around the resident's waist and the other arm around the inferior aspect of the resident's upper arm so that the caregiver's hand is supporting the resident's axilla. Let's look at some tips when ambulating our residents. Number 1, know the resident's limitations. For example, some residents become very short of breath when ambulating long distances. Some residents require special attention. For example, they may suffer from something known as orthostatic hypotension. This is where they become dizzy if they stand up too quickly, so they will need to sit on the edge of the bed for a few moments before beginning to walk. Number 2, plan on resting points before beginning to ambulate the resident. Number 3, should a resident become unsteady when you are ambulating the resident, immediately call for help. Gently lower the resident to the ground. It is much safer to gently lower a resident to the floor rather than allowing them to suddenly fall or slip out of your grasp. Never leave a resident to walk alone when it is unsafe. Never take a resident on a walk without their mobility device if they use one. We're talking about things such as walkers, canes, or quad canes. Some of you may also be taught to use something known as a gait belt when assisting a resident. This video gives you general guidelines. Always follow resident-specific protocol. Consult with your supervisor before ambulating any resident for the first time. We want our residents to have a sense of self-confidence, knowing that they look good. Personal grooming and hygiene is a part of this. Again, as we assess the potential needs of the resident, we're going to want to ask the family and resident how much assistance the resident will require. For example, with our male residents, some of them are able to shave independently with an electric razor. Others will need assistance. Most facilities will prefer that a resident use an electric razor for safety reasons. However, if a resident is going to use a safety razor to shave and you are required to assist the resident, always put on gloves before helping the resident. Assist the resident to wash their face, but do not dry the face. Apply shaving cream. Hold the resident's skin taut. Assist the resident to shave their face in the direction that the hair grows. Rinse the razor frequently in the sink to make shaving easier. Use small, very careful strokes around the lips and any indentations on the chin. Rinse the face carefully and gently dry. The resident may wish to use aftershave lotion. Many residents, for example, are able to beautifully comb the front of their hair, but they require us to come in and comb that back part of the hair so they look good from every angle. Many of our female residents feel their best when they're able to wear a little makeup. Some of them, again, can appropriately apply all of their makeup. Others will want a little assistance to make sure that the lipstick is straight and the blush is on just right. So again, providing this all the while maintaining their dignity is a very important part of what you'll be doing as a caregiver. We'll also want to think about helping the resident to dress. Some residents, again, will be fully independent, able to make their clothing selections appropriately and dress on their own. Other residents will appreciate if you come in the room and help them pick out the clothing they would like to wear. Again, some residents will require that you fully remove their clothing and assist them to put on fresh clothing each and every day. When we talk about providing for meeting the dressing needs of the resident, we'll also want to remember that it is an important part of maintaining their individual identity. So the resident should be allowed to wear the clothing they select. We can certainly encourage certain choices. For example, if it's a chilly day, we'll want to encourage the resident to select a sweater to wear, but remember, it's ultimately their choice. To dress a resident. Number 1, allow the resident to select clothing as appropriate. If a resident has cognitive impairment, it is sometimes overwhelming to select clothing from the entire closet. They do better if you present simply 2 outfits to choose from. Number 2, provide for privacy. Number 3, offer the resident to toilet before beginning to dress. Number 4,